Hello all, welcome to breakout session number 6, Overcoming School Safety Intervention Implementation Challenges. There are 4 talks scheduled for the session. We'll have Dr. Ryan Fink, Dr. Lindsey Turner, Dr. Lauren Decker-Woodrow, and then in the presentation with NIJ scientists, Dr. Mary Carlton, Dr. Nadine, Frederique, and myself. So during this session, you're more than welcome to use the chat option if you have any questions about technical issues, but then use the Q&A to submit questions for specific speakers. Questions will be answered only after all speakers have presented. So if you have a question for a specific speaker, go ahead and try and indicate that in your question when you submit it to the Q&A. And so for more information on the various speakers, please see speaker bios in the conference website. So first, we'll hear from Dr. Ryan Fink on implementation of a trauma-informed approach to PBIS.
Great, thanks. Everybody hear me okay? And everybody might see my slides okay? Wonderful. So yeah, thanks for the introduction. We'll be talking about a project we've been working on for the last 3 years now, which is to design, implement, and evaluate a trauma-informed approach to PBIS. I'm at the Consortium for Policy Research and Education, CPRE, based out of the University of Pennsylvania. Now I will find out how to advance my slides. There we go. So the official title of our project is PBIS in Challenging Context, Evaluating a Replicable Implementation Approach in Philadelphia. It does build off of a previous NIJ funded study, which I'm going to talk to a little bit about because the findings and our experiences in that first project sort of set us up and provided us direction with the current project. So the first study, again, it was a partnership with the School District of Philadelphia, and really what it was looking at was they had recently revised their code of conduct to really discourage schools from using out-of-school suspension. And so we sort of looked at the impacts of that policy change at the school level, with a particular focus on PBIS because it was such a large initiative within the school district. They had really invested in supporting many schools and implementing PBIS. So we sort of brought that extra lens to it to say, are the responses of schools that are implementing PBIS any different from schools that are not? And a couple of things that we uncovered in that first study sort of led us to reapplying for a second project and has directed our work in it. The first one, what we saw in PBIS schools was that there was a need to be more comprehensive and to include not just classroom teachers in PBIS supports and professional development, but to include what we call sort of non-instructional staff. And that includes everyone from office staff to counselors, to what's referred to in the School District of Philadelphia as sort of school climate staff, so folks that are spending time in hallways, in cafeterias, unstructured places, playgrounds. So that was one that we uncovered. The second was PBIS as a school-wide intervention. We saw lots of evidence of PBIS as a school-wide intervention. What we saw less evidence of was what PBIS looked like inside of classrooms. So you could walk the hallways, you could see PBIS posters up in the hallways, you could talk to teachers and students about the school-wide expectations, and they could respond and talk to you about that. However, what we saw was when teachers would go into their individual classrooms, as is with the case with many things, they would close their classroom door. And sometimes they would continue to adhere to the PBIS principles, but other times they kind of made it their own and were doing their own thing. And so we really wanted to penetrate in there and do some classroom coaching. And the last one that we heard a lot from teachers was, yes, PBIS is good for the most part. We think it has a positive impact on our school climate. However, this is an urban inner city with lots of poverty, and the kids are coming to school with more severe needs than what PBIS can address, more severe needs than what we as a school can address. And so some of it just felt sort of really overwhelming for them. And so we wanted to work with schools to figure out ways to address these more severe needs from their students. And so that sort of, again, sort of provided us direction for the current study. And the current study is sort of divided up into two parts. We have a large-scale RCT going on in the school district, which was supposed to be designed around sort of a light touch trauma training for school staff, in addition to training of school safety officers. And this was all K-8 schools in the district, other than the 9 in the QED that's described below, were included in randomized treatment and control conditions. And I know that part of the focus of this session here is around implementation, and most of the rest of my talk will focus on the QED because that's where most of our time and efforts have gone, and I think is sort of the more interesting piece of this. But I will say, in terms of implementation and working with large school districts, one of the things that came out of this obviously is, what you want to call it, sort of competing priorities or sort of competing initiatives. But again, the idea in the first year of the study was to give this large group of schools who were assigned to the treatment condition this sort of trauma training. And it was sort of like a 101 trauma, it wasn't sort of real in depth, but it was just sort of giving school staff sort of the basics of this and trying to get them to start to think about the ways that these types of things may be impacting their students and their student behavior. Well, in the course of us planning that and trying to get it started and working for this portion of the RCT, the school district came in and said, as a matter of fact, we want to give this to all of our schools now. So you don't have that portion of your RCT anymore because we don't want to withhold it from anybody, right? Which makes perfect sense. It's really important. It's so timely, but kind of threw a wrench in what we were doing. And so we had to sort of pivot on that and really focus on the school safety officer training, which does have some overlap into the QED, so I can talk a bit more about it. But the QED is really taking those different components that we had identified in that first study and trying to build. This is why I said at the beginning, we're not just evaluating this, we are developing it, we are implementing it, and we are trying to evaluate it with a ton of partners that I'll get to. But trying to figure out how we create sort of a trauma-informed approach to PBIS that sort of addresses the needs of the schools. And so this was a pretty intensive intervention. So, and the schools needed to be, in partnership with the district, we realized that the schools needed to be at a certain level of sort of proficiency with their PBIS implementation. So we worked with them to identify 9 schools that we deemed to be eligible, which means that they were in a place either that they had strong tier 1 fidelity, that they had a tier 2 team in place, that they had strong leadership, that these 9 schools could potentially receive and sort of thrive off of the supports that we were proposing bringing into them. So we randomly chose 4 of those schools, which became what we call our demonstration schools. So they are receiving all of these intensive supports, and then we continue to observe and collect data from 5 comparison schools. And the outcomes are proposed to be classroom level analyses. So we're looking at sort of changes in attendance, office discipline referrals, those types of things from the classroom level. But what has become more interesting over time, of course, and what we've all experienced in the last couple of school years is sort of this implementation piece. And so we've developed a really strong implementation science-informed study of the intervention as well. And so again, for the most part, I'm going to be talking about this QED portion, which is the work really within these 4 demonstration schools that we've been working with over the last 3 years. So the core components of the intervention that we wanted to make sure included were, again, sort of trauma PBIS supports together. And so I don't know where else in the presentation I get to say this, but one of the big stumbling blocks from the beginning was, and for those of you that are sort of versed in this world, hopefully this rings somewhat true, is to say that people have been talking for years about trauma-informed PBIS. And the more that I look into it and read, and the more that we sort of talk to other folks, it still felt too much like they were siloed. So we are, right, so that we are a school that does both trauma and PBIS. But it was very hard for us to get to a place where are they speaking to each other? Are they mutually facilitative? Are they strengthening one another? Do they feel to the teachers that they are one thing? or if you ask the teachers, are they going to say, yes, we do trauma and yes, we do PBIS. We wanted to really get to a place where it really felt like one intervention or one approach. And so that was, in terms of implementation, I mean, I'm not exaggerating when I say, and I'll get to our partners in a minute, that we had sort of these trauma experts, right? Trauma-informed teaching practices, trauma-informed schools experts on one side of a table, literally. And then we had our sort of PBIS experts on another side of the table. And it was many meetings, many months of them just kind of talking at each other, because and really wrestling with what will it mean for us to sort of make this into one. And so that's been a really interesting and rewarding part of this work. But again, something that we didn't necessarily foresee at the very beginning of all of this. In terms of the tier 2 and sort of addressing back to the needs of the students coming in and saying PBIS, mostly a tier 1 intervention. We have students with more severe needs. How do we go about addressing those? We have partners that have a validated universal screener tool that helps identify students with different types of needs, academic, social, behavioral needs within the schools. And then we've sort of worked with the schools in the district to outline a process to use those data in combination with other school level data to appropriately place students in tier 2 interventions based on what the screener and their other data reveal. And so that's been a process which has certainly had its fair share of obstacles as well over the last few years. And then the last part is the school safety officers, which until this year has gone relatively smoothly, and we can talk a little bit more about that. But the idea here was, again, thinking this isn't just for teachers, right? This is a school-wide intervention. Everybody that comes in contact and has meaningful interactions with students should be versed in these ideas. And so aligned with the trauma PBIS supports, we had partners from Drexel University who designed this officer manual specifically speaking to the role of school safety officers in schools. These are all the people that have to come together to do this. We have our own research team at the University of Pennsylvania that I work with. The school district has been an amazing partner, but this has all taken place within them and in many offices within their central office. I have a co-PI from the Children's Hospital of Philadelphia. Decker-Woodrow Center for Effective School is a main supporter of Philadelphia schools in their PBIS implementation. Thomas Jefferson University was bringing the trauma lens from their behavioral health folks. University of South Florida brought in the universal screener, and then I mentioned Drexel with the school safety officers. So it's been a management develop. I mean, it's been a lot to continue to wrangle all these partners. Fortunately, they're all wonderful and easy to work with, and it's really been great. Just to speak, just because I thought maybe people would be somewhat interested in how we sort of have been able to organize this team and keep the project working together. So we have our coaches who are school district employees that are working in the demonstration schools. We meet with them regularly, along with our tier 1 team, so the Decker-Woodrow team. We have a separate working group that does the tier 2 stuff. So thinking through the universal screener, what tier 2 intervention schools should have made available to them, and sort of how that whole process is going to go. And then I have to make sure that I cordon off myself to think solely about the research and the evaluation of this, because the implementation and the management of all these partners can be overwhelming at times. But thankfully, I have wonderful research partners at the university and at CHOP who sort of keep us focused on the research. So that's just a little bit in terms of how we've been able to manage this. My brief timeline of implementation, you'll get my little theme here, but so we've had 3 school years that we've been implementing this, and everybody knows what happened during the course of this. But the first year, as I was talking, like, we had this idea, we knew the importance of the intervention and the different pieces, but it didn't exist yet. And so we really sort of had to build the plane as we were flying it. Our coaches were in schools, we were supporting them, but in terms of figuring out what this model and intervention was going to really look like, it took us some time during that first year to really get our heads around what it was going to be. So we were all excited to get into the next school year in 1920, and we really started making some headway in implementing the universal screener, getting students placed into tier 2 interventions. We developed a video module series around the PBIS, the trauma PBIS stuff. And we had some classroom coaching that was really starting to take shape, and we were seeing how powerful that could be. And then March 2020 happened. And we all know, so the rest of the school year, because no one was really prepared for what that was going to look like, was sort of a wash. Of course, we came into this year much more sort of attuned to what that might look like and how that might work. But obviously the intervention itself and what we've been able to do in schools has been totally different. I mean, as of now, no student or teacher has been in person in the school district of Philadelphia. So it's been 100% virtual so far. So real quick, I just wanted to talk about a lot of the successes. I think I've touched on some of them, but we've developed this intervention. It is a real thing that exists. These video modules are getting a ton of attention across the district. We developed a 6-part video series that really sort of tangibly describes and shows teachers what we mean by a trauma-informed approach to PBIS, which is something that they were really asking for. So they would get these sort of overall light touch trauma trainings, and their questions often were, okay, but what do I do differently now as a result of me knowing about this, right? How do I interact differently with my students? How does this change what I'm doing? And so we really try to, again, sort of solidify that in their minds through these video modules. And then the officer manual that Drexel led the development of to coach school safety officers as well. I mentioned all the partners and the partnerships. It's been great. The team works on different projects together and sort of siphons itself off, and it's been really great. And I can't speak highly enough of our partners at the school district, and again across offices have been so supportive. The implementation science study, again, I think we sort of took the last spring, but even before that, sort of took the opportunity of saying, this intervention and this implementation is not going exactly as we roadmap from the beginning, but there's really good opportunities here to learn as much about implementation of these different components as possible. And so I think we're going to have some really exciting findings around that. I'm really proud of how we've handled this past school year. It has obviously been a challenge for all school districts, but the team has just sort of kept moving and kept going forward and figuring out any ways that we can implement any of these components to the schools and really support them as best as we can. And building for the future, which I'll say, at the very end for just 1 minute. And then, challenges, always challenges here. Aside from the third bullet down, which we all know was a huge challenge for everybody with the pandemic and the closure of schools. I think the thing that comes to my mind at the top is the school level buy-in and finding PD time for teachers. I mean, I would get FaceTime with principals and they were totally on board and they were ready to engage and to take hold of the supports. And it just felt like by the next week, they had moved on to 12 other things. And we were constantly working with our coaches to sort of get in their ears, but that sort of put them in a weird spot. I mean, technically the principals were their bosses and they had us as sort of this project team trying to push them in certain directions. So I feel like that whole sort of dynamic was just difficult to navigate. At times we felt like we were making inroads and people were really being responsive. And then other times, especially since last March, like other things just sort of overwhelm them. And as much as they say they want to prioritize these things and that they do truly prioritize them, it just sort of all gets sort of swamped up. And us being, aside from the coaches, many of us being from outside the district had sort of less sort of sway and time with them. I mentioned the competing initiatives, other things coming in and taking people's time. And then the last thing I'll mention here is just sort of identifying ways to collect data reflecting actual practice in classrooms. We spent a lot of time and resources going in and doing actual observations of teachers. It never sort of, we had one good sort of administration of that, which we were holding onto as hopefully some baseline data for our QED analyses. And we were supposed to do follow-up last spring. And of course, that didn't happen. And of course, now it can't happen in this school year. And so we have teacher beliefs, we have teacher knowledge, we have administrative data we can look at. But I think one thing that we thought was a real strength of the project that I'm not sure we're going to be able to salvage in a meaningful way is actually looking and seeing what changes in practice were actually happening inside of classrooms. And then I'll just end by saying we've taken this opportunity also to, the district has really latched on to a lot of the work that we're doing. And so we're helping them build for sustainability of some of these things, adapting the manual for non-instructional staff other than officers. They really want the universal screener to become common practice in their schools. So helping them think about sort of what the infrastructure and supports need to look like around that. And then the video modules series, they are holding on to a sort of a centerpiece that they want to have for schools if and when, I guess, students and teachers start returning, because they think it's that valuable. So helping them sort of, again, make that a permanent part of the way that they do their work. So thank you for listening. I hope some of that rang true and made sense. I look forward to the other presentations and conversations and questions.
Thank you so much, Dr. Fink. Next, we will be hearing from Dr. Lindsey Turner on studying implementation of PBIS in rural schools during challenging times.
Hi. Okay, can you all hear me? Great, I forgot to unmute myself before I started sharing my slides, so I'm glad that that worked. So our project is focusing on PBIS, like Dr. Fink's project, in rural schools. And so to set the stage, I will talk a little bit about what rural areas look like in the US. Many states have rural areas, but we have this whole enormous area of the Intermountain West, kind of from the middle of the country to the west, that is incredibly sparsely populated, with the exception of a few areas like Salt Lake, Denver, Phoenix. And I live and work up here in Boise, Idaho, which is an extremely rural state. So it's also a mountainous state, which poses a lot of trouble for travel and getting around, particularly in the winter and the kind of weather that we're having right now. And this is our density and our school location. So those blue dots each are schools. We have 700 schools, and the majority of those are in rural areas. And of our about 300,000 K-12 students, half of them live in rural areas. And when I say rural, I'm using the NCES designation for rural, and then we also include townships, small townships as well. And this is another characterization of rurality, which I find really interesting, because I think it just reflects the diversity of different types of rural. So all rural communities are not the same. And while in our project, we're looking to study implementation in rural settings, I think in terms of generalizability, it's important to recognize that what we're learning here may or may not necessarily relate in other areas, but really hoping to test a strategy that should be able to be scaled up elsewhere. And those blue areas are the types of rural communities that we have here in Idaho. These are a couple of the schools that are working in our project, located in mountain areas, beautiful areas. And right now they look sort of like this, like much of the rest of the country. Unfortunately, we had a foot of snow here in Boise over the weekend, which is unusual. But in these communities that we're working with, they often get snowed in. So from about December to March, it can be pretty hard to get out there. And our rural, with the diversity of our rural communities, we also have some in desert areas, and then we have some in farmlands as well. So fairly diverse set of rural schools that we're working with. We also know that rural communities have many risk factors for adverse outcomes, and then fewer community protective factors. A couple of those listed here. And particularly relevant to our work is the school capacity to implement evidence-based practices. So with the one that we're discussing here being PBIS. And these pertain to things like location, so distance from urban areas where they can access expertise and professional development, transportation challenges and resource constraints, and then also some of these cultural issues around a distrust of outsiders and really wanting their strategies to be locally grown and come from the communities, and also the student characteristics. So our poverty levels are higher in those rural settings. And this is a description of our project. We call it our K-12, Rural K-12, and it's a cluster randomized project. And in the implementation science language, it's a type 3 hybrid. So meaning that what we're really focusing on here is understanding how to implement an EBP. And the evidence-based practice is PBIS, really commonly used, uses that tiered implementation approach. And then our intervention that we're testing is designed to figure out if we can help schools to more rapidly implement with fidelity through a kind of a basket of implementation strategies that are specifically designed to address some of these barriers that we see in rural schools. And PBIS, I should note, uses a team-based implementation strategy at the school. And so in our 40 schools, what we had them do was identify a tier 1 team, which included a coach, and that coach is typically a counselor if they have one, if not someone in another role, and the principal, and then 3 or 4 other people, depending on interest and availability. And in some of our smaller schools, there just isn't the staff capacity, so their teams tend to be a little bit smaller. And for the purposes of statistical power, we did set an enrollment criteria that schools had to serve at least 100 students. Now we have a lot of rural schools that serve very few students, but those are not participating in our study. And here's what we planned starting out pre-COVID. So we are using a mixed methods approach to gathering data. Standardized climate surveys, well-validated tools for students, staff, and parents. And in our staff survey, we've added in a lot of those things that I, as an implementation scientist, are particularly interested in understanding: readiness for implementation, things like psychological safety, perceived transformational leadership, and those other things that could affect the implementation of an evidence-based practice in a school. And then that team at each school, we do more frequent surveys with them around process, how they're meeting, about their team dynamics and what they're doing. We have a couple different standard implementation fidelity measures that are used in PBIS world, and then an on-site safety, school safety environment tool. This is developed by Sarah Lindstrom Johnson and her colleagues. And this assesses aspects of the built environment that contribute to students' perceptions of safety and safety outcomes. And at the student level, we have the standard ODRs, disciplinary referrals, and academic achievement. And most of that data collection happens in the spring of each year. So in the intervening summers is when we started our training. So our grant started in 2018. We used that to develop our implementation, or our intervention, of those implementation boosters. And then in 2019, we started rolling with data collection at baseline in the spring of that 2019 year, followed by our first training for all schools in the summer. And then the goal was to continue that pattern for the next couple of years. And here's what our intervention schools are getting is virtual learning sessions and an online portal, again, developed with the goal of being able to reach those distant schools that are in remote areas. Some leadership and coaching skills. Unfortunately, those had all been developed and delivered pre-COVID, and then technical assistance and coaching. And our plan, actually, because recognizing that the weather was about to get bad in December, we did those on-site in the fall. So our coaches, our implementation specialists, could go out to the schools, work with those teams, get to know them, get to know the kids, and then pivoted those to virtual. So even pre-COVID, we had pivoted that technical assistance support to a virtual approach. So here was the ideal plan for data collection. And here's what actually happened. I've crossed them all out in red, what we did not manage to get. Our schools were actually late to close in Idaho. We had a shutdown on March 26th, among the latest in the nation to do so. But by early March, I was starting to get worried, and I pulled our team out of the field. So we got set on-site visits from about 10 schools, and we didn't get very many of those other things. Obviously, no academic achievement because schools couldn't do that. We did, however, manage to get staff surveys. We just scrambled day and night to deploy those surveys early and catch them from staff. So at least we have a follow-up year of staff surveys and perceptions. And then down here, in terms of the tier 2 training, we went virtual. So in March, I made the call that we were likely to not get back to an in-person approach for the summer, and we pivoted those all virtual, which I'll talk about in a minute. And so here is our hope that through a no-cost extension, we can push out another year of data collection, and then this coming summer, we can help schools with a reboot. It looks like things hopefully with vaccine rollout, we'll get back a little bit more to normal in the fall, and that our schools were already starting to hear that when they're back in person, they want to kind of get going again on this. So we'll help them with a reboot. We have added on interviews. This was part of our plan to do in the end year, was to do some retrospective interviews, but we accelerated those, recognizing that things were just really unusual in the spring and wanted to get a sense of what schools were doing to adapt and what they had done thus far. And I'll talk a little bit about some of the themes that we found from these interviews. This targeted the coach and the principals, and we got most of them. And then we are currently in the field right now with some brief interviews just to figure out how it's going now. We're about a year into the pandemic, figuring out how they're keeping up and what they're doing. And these were all consented, recorded by Zoom, and then transcribed, and we're coding them right now. So themes from that first set of interviews very early on in the pandemic, we found that administrators tended to be a little bit more positive than their PBIS coaches at the same schools, and the intervention schools perceive things to be going a little bit more positively. And in those intervention schools only, that in-person support, those first couple months in that fall of the 2019 school year, was incredibly highly rated. Comments like face-to-face is more powerful. And so even before everyone was forced to go virtual because of the pandemic, we were getting a little bit of not pushback, but just comments that we really miss the coaches and wish they were here. The feedback was, very good acceptability for the types of strategies that were being used. These were really tailored and customized to what each school needed. And then also really appreciation for the way in which those coaches did what they did, that they're just wonderful, supportive, positive. And here are our coaches. Their role is implementation specialists, but we call them our K-12 coaches. Tate and Nate are our tier 2 trainers. And that's on the right, a photo of them with Rob Horner, one of the developers of PBIS. And Rob is not part of our study, but Terry Lewis, who is our advanced tiers trainer, did her dissertation with Rob Horner and George Sagai. She's been working in PBIS for 2 decades and knows it inside and out. So our team is just wonderful. And as we can tell from those comments, the way that they go about doing their work is really appreciated by these schools. We did that rapid pivot to online for our summer institutes. And so here's our scope and sequence. And we kept the groups in the same groupings and sequence that they had been in when they were in person, because they had already started to make some connections with other schools. That was one of our goal too, was some sort of regional connections. And we sent them some tip sheets ahead of time about just sort of how this would work, getting used to the technology. We were all sort of on that Zoom learning curve at this point in June of last year. Maybe now we've all had a little too much of it, but just helping people to prepare for the meeting. And then the first day of that online meeting, just really kind of talking logistics, helping people figure out what we would do. Our team, Tate, Nate, and Terry, used really effective use of breakout rooms, so each school's team could meet together and go off an action plan and then come back and discuss as a big group, and we found that to be very effective. In terms of the adjustments to our intervention, really not many, because as I mentioned, the whole goal was to figure out a set of implementation support strategies that we could do with these remote schools that would be feasible to do. So not a lot of changes here for the virtual learning sessions. And just a quick sneak peek on our very first year of Fidelity on implementation. And so recognizing that this was just a couple months into the pandemic, we got these in May and June of 2020, but really remarkable strides considering everything that our schools went through last year. And we took a look at that number of schools that reached the 70% as sort of an indicator of really, are they sort of implementing it with fidelity or close to fidelity, and found that 16 of the schools in the intervention condition and 11 of the schools in the control condition were implementing at that 70% level. So I think we're starting to see some evidence that these implementation support strategies are helping. Just a quick update on what we're finding right now from these emerging interviews, kind of what's expected. This year has been really hard. Everyone is stretched very thin, and PBIS has been put on the back burner. some adaptations in terms of how they're using PBIS, with the main one being that they're not using behavior tracking as much or other strategies from PBIS. But they seem to think that they're really not needing it, that social distancing, and then of course the hybrid or remote learning, they're not needing it. They're reporting far fewer behavior corrections. And interestingly, we heard that parent engagement looks different and is more this year. And I suppose that really makes sense as parents are concerned about the physical safety of their kids around COVID. So they're more in touch with teachers, and teachers are not necessarily as much in contact with their colleagues at their schools. Our next steps are to keep providing these virtual implementation supports, to do whatever we can to be a good partner to our schools as they navigate this really challenging time, gather as much data as we can, and then loads of analyses. Even though we missed a lot of data last spring, we still have a lot from baseline, and then some still from 2020. So I'm really excited to dig in and look at that. Huge gratitude to our team. It's been a rough year, and they have all been troopers and have just been so adaptable and flexible and positive about all of it. And so thank you. And I would be happy to take questions at the end.
Thank you so much, Dr. Turner. Next, we'll hear from Dr. Lauren Decker-Woodrow on integrated supports for vulnerable middle school students, importance of implementation and context in randomized control trials.
Apologies for the very long title. I'm not sure how to, if somebody else can stop the sharing, and then I'll be able to share mine. There we go, thanks. Okay, well, I love the little bit of variability we have across our 3 presentations, because we were actually able to complete our study prior to COVID. But nonetheless, we have lots of challenges to still discuss and talk about that actually did not have to do with COVID. And here, as you see, some other authors and partners we had in this work, both from where I'm at Westat, but also our Communities in Schools partner, who we worked very closely with on this work. So I want to spend the bulk of the time talking about some of the interesting things we learned about the challenges in the schools. But to give you a quick overview first, we were looking at a randomized control trial of Communities in Schools, but this was not Communities in Schools or not as a treatment and control condition, rather a more intensive version of Communities in Schools services that our partner was interested in testing compared to their typical services that they provide. So to give everybody a sense, this is an in-school wraparound services support program that's in more than 24 states across the country. And they offer both school-wide supports, but also case-managed individual student supports. And where our randomized control trial was looking was in these case-managed students. And as I said, this wasn't a Communities in Schools compared to not. This was their typical services compared to a more intensive version that one of the Communities in Schools partners was really attempting to create on their own in one of their schools prior to our NIJ funded study. And in the traditional model of the case management for students in our Communities in Schools partner, the ratio of coordinators to students, so coordinator is the Communities in Schools person who's on site at the school, could be 1 coordinator to 100 students. And they were aiming for between 22 to 48 hours of targeted services to those students every year. Well, as you can imagine, with a ratio of 1 to 100, that tends to be challenging and may not get as deep as they'd like. So our partner was trying this more intensive version where they cut that ratio in half. They were greatly increasing their targeted number of service hours in hopes that they could get much more familiar and understanding the needs of the individual student, and in essence become proactive in the services and supports they were providing. So rather than having a situation arise, whether it's attendance, behavior, course challenges and difficulties, They were hoping to get a little more proactive in identifying the needs and supports of the student by being able to spend more time with them, and in hopes of driving outcomes higher for those students. They also, for this more intensive version known as ACT, included a separate parent liaison. So in typical communities and schools supports, it was up to that one coordinator at the school to reach out to parents or guardians when any additional services or conversations might be warranted. But in the more intensive version, this ACT version, there was a separate parent liaison per school who was able to support the outreach as well as those conversations. And so our study was a randomized controlled trial, and I'm happy to talk later in the questions if everybody needs to know a little bit more, but we had this larger study. Not every single student was randomly assigned, so we focused our analyses on the randomly assigned sample. And these were 6th through 8th graders across 5 middle schools in an urban district. And we collected not only the outcome data and baseline data, but as much fidelity information as we could as well. And you'll see how that became really important for us to understand some of the challenges that we were facing and how that was resulting in the findings that we had. And we were able to do this study over 3 academic years. And as you can see, our last year was right before the COVID challenges. So we were very fortunate to be able to complete it at that time. To cut right to the chase for the impact results, we didn't find any difference. So one hypothesis would be that this more intensive attention to case managing students really wasn't doing anything different than their typical model. And their typical model is much more cost effective. So that might seem to suggest, well, great, just keep doing what you're doing as communities and schools. However, we had a question of, is that really the case? What did we actually measure? Was implementation fidelity present to warrant that conclusion? And cut to the story short, no. So in reality, what you're looking at here between these 2 sets of bars, the far left was that planned minimum hours of services. And then each of the bars on the right of that are where the average actually lay. And when you even go into the student level, there was only a handful of students in the more intensive condition and only a handful of students in the business as usual condition that even reached those minimum thresholds. So on average, the amount of services anticipated and aimed for weren't even coming close to happening. Now, it's important to keep in mind, we did see a significant difference between the amount of services in the more intensive model. The students were receiving significantly more hours of service, but it was still not coming anywhere close to what the expected minimums were that they were supposed to be targeting. So you could stop there and say, well, we didn't actually have the opportunity to evaluate the intended dosage. However, we wanted to know why. Because these numbers are so drastically different from where they should have been targeting, what was happening? What was the reasoning behind some of this? And fortunately, our communities and schools partner from the beginning was collecting a lot of really rich data from each of the campuses that we were involved in. We were able to utilize that information and start coming up with some explanations. And those explanations pulled out some of the challenges that these communities and schools coordinators were facing living within the schools. So keeping in mind the way this program operates is this site coordinator and any of the additional staff are actually sitting within the schools. They work within the schools every day because that's where the students are to gain the most support. They are there before school, they're after school, really trying to support students and their families as much as possible. But we found some interesting things when we looked deeper into this type of contextual information that communities and schools was gathering. First, the amount of turnover in the coordinator and these liaison positions. There were also some tutors they were bringing in to support students. We saw between 33 and 200% turnover. Now, where this is important to keep in mind in terms of the potential effectiveness of the communities and school services is the site coordinator is someone in a position who is seen as being a stable, responsible adult mentor in a student's life. But if the turnover is this great over the course of the year, really a true mentoring relationship can't actually take hold from a reasonable perspective. So that mentoring connection that CIS was striving for may not have been happening. That could be impacting motivation for students in a variety of outcomes. But even beyond that, something that was interesting was the communities and schools staff were asking these site coordinators every month throughout the entire implementation, what other responsibilities were school staff and administration asking of them? So keeping in mind, the schools that we were in were targeted for communities and schools supports for particular reasons, because they had a vast majority of students who could benefit for the supports, would be eligible to receive the supports. And I'll talk in a minute about some of the school's challenges as well. So the administrators and staff in the school all of a sudden have one or two other adults within their midst. They're already struggling with a lot of things they have to do and a lot of tasks they're responsible for. And all of a sudden there are other people here. So what was happening is these site coordinators, the parent liaisons, were being asked several times a day, every day, to take on other responsibilities to support the administration of the school. And what that inherently did was took their time away from being able to do the services that they were actually being hired and placed in the school to do. So while the staff and administration most likely were trying to put out fires, were reacting to something, and they needed other responsible adults to support, they in essence were maybe potentially hurting themselves by not allowing the coordinators time to focus on those services for students. So at one point, we could see a range between 300 and more than 5,000 additional asks over the course of a year. And when we think about that, that's several times a day, every day, that you're being pulled away from the direct services to your case managed students. From the school level perspective, we were in 5 middle schools in a highly concentrated area where there were several additional demands that were happening at the school level. We did have a district reorganization in the middle of our study between year 2 and year 3. That one school, middle school, was shut down, and those students were subsumed into a feeder pattern high school. We had some administrator turnover. So our communities and schools partners had to go back in the second year of the study, in the third year of the study, and talk to the new administration, explain what we were doing, how we were doing it. So there was also this revolving buy-in challenge that we were facing. And there were also district improvement pressures. So there were a lot of issues for some of these schools. They had been identified for district improvement efforts and strategies and focus. So this really led to competing priorities for administration. So oftentimes they were making some choices, as I said, redirecting some site coordinators to do other things in a variety of ways. So we just wanted to offer, based on this experience over a number of years, some things that we saw that we'd love to consider for next time as well, and some things that worked really well that we were already collecting to provide some of this context. First, wherever we're going to be going forward, or if anybody else is planning a study, thinking deeply as much as we can about the potential risk that may already exist in some of the schools or districts that we're going into, and making some decisions ahead of time to say, are these potential risks that will really change the course of the study or potentially disrupt the study? And if not, if there are risks we believe we can handle and be flexible around, such as the way we do random assignment or something like that, then let's just think about what our potential backup plans might be and how we might move forward with that to make sure. One of the other things, as I was saying, the fact that we had as much contextual information as we did to not only understand the fidelity and dosage, but then to start understanding potential context stressors that were to explain our lack of fidelity became really critical for us for talking about the context that these students and the communities and schools were working within. So thinking right from the beginning of a study, what information, contextual and fidelity, can you be collecting so that if you run into any of these challenges, you may have more information to share, to discuss, to think about as the end result of the study. Because really without that information, we feel like we really weren't sure, what was going on. And it really helped us tell more of the story of the study and of these schools as well. And considering the continuum of research, and what I mean here is thinking carefully when you're in randomized control trials, whether you're putting forth an efficacy trial where you are deeply, deeply overhanded with how everything is going and making sure that fidelity is happening amazingly, and whether your context is really supportive of that, or whether you're in more of an effectiveness sort of trial where it comes to that more real world context where we know we'll have massive variability in fidelity, and where is the treatment in its continuum of research understanding? Do you already have some data that say really strongly you know there will be significant effects if you're in efficacy? Then you can be ready to move to these more real world contexts. So that was just a little picture from our example, and would love to hear everyone's thoughts. Thank you.
Thank you so much, Dr. Decker-Woodrow. Last, we will hear from NIJ scientist Dr. Mary Carlton, Dr. Nadine Frederique, and myself on the National Institute of Justice's Comprehensive School Safety Framework.
Thanks, Caleb. Great. So I'm going to talk to you real briefly about this framework. And I should say, so many of our other panelists this afternoon have talked with a lot of detail about work that they have done to implement various programs and challenges they faced. And our framework discussion this afternoon is taking what we've learned from research on school safety, drawing very heavily on NIJ-funded research through the Comprehensive School Safety Initiative, and trying to develop a framework that that schools will be able to use to take a comprehensive approach. So we're at the very earliest of the implementation phase here, probably implementation planning phase based on research. Nadine? There we go. Okay. So real quickly, I'm going to talk about what we'd like you to draw from the presentation, what we're hoping that you're going to understand in terms of what we mean by our comprehensive framework, which has 3 elements. And so we're really going to spend most of the time focusing on what those 3 elements are and how we think they can work together or should work together. And then we'll just kind of bring it all together. So broadly, sort of the key message, if you will, from the comprehensive approach that we're talking about is the idea that school safety is multifaceted. It's not just one thing moving to improve school safety. It's complex, and it requires all key players coming together from different disciplines, different systems to use research and help all the stakeholders in the school community focus on improving school safety. So I talked about the 3 elements real quickly, and really what I want you to draw from this slide is sort of the movement here and the interconnected nature that we would argue that the elements of physical safety, which we're thinking about issues like access control and security, the climate, which we heard a little bit from our other presenters about just a few moments ago, and this notion of student behavior, that we can think about approaches and tactics in each of these 3 core areas. And we think that attention in each of these 3 areas will help schools move in the direction of improving school safety in the ways that they desire, and that this represents a comprehensive approach. So we've already heard about school climate from our other presenters, so I won't spend too much time here, but a couple of key points to make when thinking about school climate is that measures of school climate vary. So some folks looking at, how am I doing in terms of school climate might emphasize things like the support structures that students have, how connected folks feel to the school, both parents and students and teachers, the physical disorder of the school, sense of fairness. Not all measures are necessarily the same, and that might account for some of what appears to be what looks like disagreement, if you will, within the literature, sort of understanding what school climate is, or am I doing a good job or not? And we're starting to really learn from the research as folks are really digging deep into school climate, what concepts may be more important than others. And I won't get to talking about the measures, but to say at the end that we provide some direction to where to get a little bit more information on what those measures are, should you be interested in pursuing that. So why should you care about school climate when it comes to school safety? The evidence is pretty strong that a positive school climate can help keep students safe and promote other outcomes that are desirable for both students and schools. And these are just a few examples of where the research says that school climate, positive school climate is important. We see improvements in individual student behavior in engaging in bullying or being acting as a bully. We see improvements in students seeking help, in students wanting to come to school. And then in terms of kind of other behavior, not just one's individual behavior or misbehavior, but if they hear about a threat of violence, a positive school climate can help increase the likelihood that students will report that to a trusted adult at the school. So a little bit about measuring school climate. So just some really high level points to make here, that the research suggests that periodic measurement is important to get a baseline of where things are now, particularly if you're interested in making improvements. And when looking at the results from school climate measures, really two things to draw from. And one is to expect that perceptions will vary on school climate. You've got lots of different folks in the school who come with lots of different experiences. We can expect that students, depending on their characteristics or how well they're performing in school, will have different perspectives on school climate. We can expect that those who've been victimized at the school will have different perspectives on school climate. So it's important to make sure that different folks are being asked about school climate and to look and see where those variations exist, as well as to kind of dig deep and not just look at an overall measure of climate, but to try to understand where are the areas that it looks like in our school we're doing really well on and those areas we're not doing as well on, because of course that helps point in the direction if you're looking to make improvements of where those improvements should be made. And we're learning a lot from research about what we can actually do to improve school climate. And a really high level picture here, there isn't one recipe to getting to a desirable school climate, but we are starting to learn and see that there's strong evidence for certain approaches that can help improve school climate. And these can overlap with other things that schools are doing to improve school safety. So for example, we'll talk in a moment about discipline, but having appropriate discipline that's understood, consistent, and fair can improve school climate, have other desirable outcomes. Making sure that there are interventions to meet the social emotional needs of students can help improve the overall school climate. A final note on the notion of measurement, we talk about this periodic measurement. Another time to take a step back and take a look at and see what a school climate is after a measure has been introduced and it's had enough time to really kind of take hold. So we heard a lot about implementation challenges earlier. Sometimes it's hard to get these interventions to take hold, but once that has occurred, or you feel like it's sort of necessary to take the temperature, it's a good time to do that measure. We still have lots to learn. about how to improve school climate and why some of these approaches are effective, but we really are starting to sort of move the needle and advance our understanding.
Thank you, Mary. Effective management of student behavior is yet another interconnected component of improving and maintaining school safety. NIJ sees management of student behavior as the policies and practices schools have in place for addressing students' mental health and trauma, their behavioral health, as well as the approach to discipline. Just as the school's climate and physical safety is impacted by a student's approach to, or a school's approach to managing behavior, when trauma and students' mental and behavioral health needs are addressed, they're going to be less prone to disciplinary issues. So by providing teachers and administrators with evidence-based practices which address student needs, we can reduce the reliance on exclusionary disciplinary practices like suspension and expulsion, which suffer from well-documented racial disparities and can reinforce students' perceptions of unfair disciplinary practices, which will adversely impact school climate and can make schools less safe. To counteract these influences, school policies should prioritize individual level student needs, as well as school-wide needs to more effectively manage student behavior. So over the next few slides, we'll provide some general guidelines for managing student behavior based on CSSI research. In order to appropriately address student mental health and trauma, research suggests supporting students through implementing social and emotional learning programs and other mental health monitoring and support systems. Addressing mental health and trauma, again, are critical to managing student behavior because students who have experienced trauma have an increased likelihood of acting out at school. Implementing social and emotional learning programs can help students learn to manage their emotions and behavior. CSSI-funded research also suggests adopting universal mental health screening so that students in need can be identified for the right kinds of services. Though such screening can be problematic because many schools do not necessarily have the resources to address students' mental health needs once identified. This suggests that adopting mental health screening really needs to be accompanied with the necessary counselors and support staff to address students' various mental health needs. Providing these supports is critical as mental health problems and traumatic aversive childhood events that are not addressed have been linked to negative outcomes for students such as poor academic achievement, behavioral problems, dropping out of school, and delinquency. These negative outcomes, again, can then manifest themselves in disruptions in the general school climate and in physical safety. Behavioral health is a little more broadly defined and can refer to support services for both students and teachers, which are not necessarily specific to trauma and mental health. So this includes classroom management approaches to bullying, and other programs which may impact important student outcomes like academic achievement. We need to, again, to support teachers and provide them with the resources and policies to meet their students' needs and to manage behavior in the classroom. And so while there are a number of independent kinds of programs and practices which address some of these issues specifically, many of which are highlighted at this conference, most practices can really be adopted within a multi-tiered system of support, or MTSS. Based on public health models, MTSS provide both broad and individualized interventions and divides supports into different tiers, and it provides a framework for implementing both district and school-wide changes to programs and policies. A common example of MTSS used in schools is PBIS, which you've been hearing about in the last couple talks. Interventions and programs at different tiers may require the involvement of more than just school officials, but also parents, community stakeholders, and other members of the student support network. While implementing programs to support the needs of students and teachers is critical, schools do have a responsibility to respond to undesirable behavior. Although addressing student trauma, mental and behavioral health prevents a lot of this undesirable behavior and really the need for a disciplinary response, sometimes there might still be this need. And so when a disciplinary response is deemed to be necessary, CSSI research suggests adopting a disciplinary policy which is strict but fair, clearly defined, and widely known by both students and parents, as to have a positive influence on both student behavior and school climate, through in part actually reducing the reliance on exclusionary discipline practices. CSSI has also funded research on restorative practices or restorative justice practices, which have been demonstrated as a promising alternative to traditional school discipline, as restorative practices promote problem solving between students. Restorative practices have also been shown to improve school climate and result in a reduction in overall suspension rates and a reduction in the disparities of suspension rates between African-American and white students and poor and or low-income and high-income students. But more research is needed.
All right, thank you, Caleb. This part of the presentation, we're going to talk about creating a physically safe school. And when you think about creating a physically safe school with a comprehensive approach, you really need to think about the strategies and interventions and policies that would ensure physical safety. And so for the goals of this part of the presentation are to really look at how we maintain the physical features of a school, we manage who enters and exits the schools, and how to keep students, staff, and their property safe from hazards inside and outside of the school. To do this, I'm going to focus on 4 areas, though there's many others that we could focus on. We're just going to focus on these 4, sorry. But I want to emphasize the point that each of these play a different role depending on the type of school, the location of the school, and the different hazards that face different school districts. So even in this session, we've got urban school district, we've got rural school districts, we've got a wide range, and each of them will face their own different hazards. So technology is important to improving school safety. There are many technologies that are currently employed. Here are some examples here. I will point you to some of the resources that we have on the NIJ website. So NIJ, through the School Safety Initiative, did work with RAND and the Johns Hopkins Institute to do a thorough review of the different technologies that are going to be employed to improve physical safety. And so for more information, I refer you to those reports. But one thing to keep in mind is that technology may have unintended consequences on the perceptions of fear and victimization in the school climate. Perfect example is metal detectors. So when metal detectors are used in different jurisdictions, they may increase the perception that the school is not safe, that it's not a welcoming environment, and that really has an impact on school climate, as Mary mentioned before. Another important factor to consider when thinking about technology is where the barriers that may prevent adoption of technology solutions. So for example, in the plenary panel this morning, we heard Kevin Bethel talked about cost and whether or not you want to calculate the trade-off of $1 million for cameras versus implementing other programs that might impact school climate. And those are real trade-offs that a school district has to consider when thinking about implementing technology solutions. Another really important aspect of maintaining the physical safety is about tips and tip lines in reporting threats. So this conference, we have the privilege of having Dewey Cornell and some other folks who are doing really innovative work in tips and threat assessment and also tip lines. And so I'd also point you to those presentations and those resources on the resource page. But just keep in mind that tip lines are not just a phone line. They also include texts, emails, apps, live interaction, websites. Safe to Tell, which we've heard about a little bit today so far, is I would call it the OG or the pioneering tip line in school safety. We have several rigorous evaluations of tip lines that are happening all across the country. And my colleague who presented earlier, Mary Carlton, has a forthcoming NIJ journal article that really talks about tip lines. So I'd also point you to those resources. But I did want to point out that there are some things that we know about successful tip lines. And those are that they demonstrate a coordinated way to receive threats and to respond to the threats in a systematic way. The successful tip lines that we've seen, they provide investments in technology. They provide training for the people who are going to be reporting tip lines and also for the people who are going to be responding to them. And they also really emphasize student engagement. And I think that's something that we really want to focus on in terms of understanding how the responsible use of tip lines. So you have a tip line. what do you do with the tips? Threat assessment. So as Dewey Cornell talked about earlier in his session, it's really important to consider having a really thorough way to respond to threats. So what is threat assessment? It's a violence prevention strategy that involves reviewing the threats of acts of violence, determining the seriousness of the threats, and developing intervention plans to protect potential victims and address the underlying problems or conflicts that might have stimulated that threatening behavior. Threat assessment should be used in concert with a considered approach to collecting information, tip lines, which may be other means to report information or threats to safety. Tip lines are a helpful way to collect the information, but threat assessment is also a very effective strategy because it can prevent overreactions and underreactions to those threats that are reported. As Dewey Cornell mentioned in his presentation earlier, there's no disparities among Black, Hispanic, or white students in the result of the tip. So they're not more disproportionately likely to have out-of-school suspensions, school transfers, or legal actions as a result of threats. So that's a positive outcome from the threat assessment literature, a happy outcome that demonstrates that this considered approach to assessing threats of violence is really important to reducing some of the disparities in school discipline that we see. We also know from the threat assessment literature that there's the no snitching culture, and it's really important for implementation of threat assessment to consider how do you overcome students' resistance to reporting threats. So we funded a project called SOARS, which developed the Advocator app, and they paired that with an educational program that normed social behavior. So it talked about how reporting a threat is about saving lives and not snitching. And Dewey Cornell talked about that in his presentation as well. So I'd refer you to his presentation after this to get some more information on that. Emergency operations plans are also important guidelines to improving the physical safety of a school. These guidelines have been developed at the federal level, and we're hoping that they have increased uptake by school districts. We have pioneered a lot of research on assessing emergency operations plans, and some of those researchers are going to be, again, talking at this conference today, so I won't go into a lot of detail about those projects, but just to point you to their presentations. But to consider that there's a large disparity between a good emergency operations plan and a bad emergency operations plan. I think from some of the research, we've learned that, that the comprehension of emergency operations plans is not consistent across the school community. So people who are on the response team for emergencies might have greater comprehension than, say, your other important school staff, like the cafeteria staff or custodial staff. But every member of the school community needs to be able to comprehend the plan so they know when do you do a lockdown versus when do you evacuate the school building. And those things need to be communicated. I think another thing that we've learned from that research is that having a small plan is better than a large plan. So emergency operations plans can be really complicated, really complex and cumbersome, and that really decreases the ability of staff to comprehend what's happening. So for more information, again, I'll point you to the resource page. We've got several videos that talk about our research from emergency operations plans, and also the presentations from Josh Hendricks and Suyapa Silva from RTI, who have done a lot of work in this area. School resource officers, we know for the last 6 months or so, have been a controversial topic when you think about school safety. So for the purposes of this presentation, we know that there are calls to remove them from schools and a lot of things like that, but we're not gonna tackle that issue here, whether they should be there or not. Here we'll say that if you do choose to use school resource officers to help improve physical safety in a school, there are some things that you should consider. The CSSI research suggests that school resource officers are more likely to be involved in formal responses to crime on school property, but they're also really helpful in coordinating the development and response of good emergency operations plans, conducting threat assessments, and helping to respond to issues in schools. But we know that there's a consensus that SROs should not be involved in routine school discipline matters. So this is a really key point, because when SROs are pulled into routine discipline matters, that's when we see a lot of those really bad videos that you see on TV about school officers doing horrible things. And so one recommendation, one consensus is that SROs should not be used in these routine school discipline matters. We also know that training and selection of the right officers is critical. You know, NIJ has been doing a lot of work looking at the role of school resource officers, training and selection. And we are finding that it's really important to have the right people there and afford them opportunities to the right training. So as Kevin Bethel talked about this morning, in his work with the school safety officers in Philadelphia, kind of training changing their orientation, allowing them to have access to trainings like the NASRO training, the National Association of School Resource Officers training, looking at things like positive youth development, or looking at adolescent brain development research and helping school resource officers understand adolescence and how to respond to that in different ways than they're normally trained to do as police officers is really important. So what are some recommendations in thinking about school resource officers? We'll really have to note that there is no implementation model that tells schools or districts how to implement school resource officers. So that's one area of recommendation, is that we probably need to move to a place where we can start learning from the research that we've funded and develop a model for implementing school-based police officers. And we also need to evaluate and improve and evaluate that rigorously in the field so we can improve the model of implementation, right? So what we have now, similar to the education, when you have thousands of districts across the country, we've got probably thousands of different models of how school resource officers or school-based police are implemented. And so moving to a place where we can start to recommend a more evidence-based, informed model of implementation. So tying it all together, thinking about this framework that we're talking about, I think through this presentation that you'll have seen that improving school safety is highly complex and involves multiple interrelated concepts. So between Caleb, Mary, and myself, we've talked about many different things that we would include in a comprehensive framework to improve school safety. It's also really important, as our graphic just demonstrated, that the changes and challenges in one area may impact another area. So understanding that discipline practices may have an impact on the school climate if it's perceived as arbitrary or unfair or exclusionary. It's really also important to consider that stakeholders involved in ensuring school safety all need to work together in a coordinated way. I think Mary talked about all the different people who are involved in ensuring the safety of our students in our schools, right? From the principal, from school district leadership to the lunch lady and the custodian. Everybody's going to have a role to play, and we all need to be working together and talking about whose role is what, and how do we improve school safety of our students. We also want to kind of make a point that schools that employ comprehensive approaches to addressing violence are not immune from school violence. However, implementing a comprehensive approach minimizes the chance of serious violence, and it also prepares schools to recover from the effects of violence when they do happen. So that's the conclusion of my presentation, our presentation on the NIJ School Safety Framework. So I'll turn it back over to Caleb.
Well, thank you to all of our speakers. And so we have our question and answer section. And so if you have questions for any specific speakers, you can go ahead and submit them there. It does look like we do have one question already for Ryan.
I see that one in there, and I mean, Nadine just sort of echoed some of this, but I'm not sure if this is what the questioner is getting at. But those to us are names for the same thing. Kevin Bethel, who Nadine just mentioned, who leads the school police in the school district of Philadelphia, recently renamed the position to become school safety officers. They were school resource officers before that, but we're talking about the same role in schools, if that makes sense and if that answers the question.
Caleb, can I ask a question?
Please.
And this is for Lauren. I was kind of wondering if you could tell us a little bit more about the Communities in Schools program. Kind of what were the components of that? How was that sort of implemented? Just a little bit more description about that.
Sure, absolutely. So there are different affiliates across, as you saw on the slide, 25 states. And then there's also a national communities and schools organization. So while they all do very similar things, there are slight variations across states. Some affiliates operate within a state. Some states have their, for example, state education agency over any affiliates within the state. So there are some different mechanisms, so slightly varying restrictions or cutoffs or things like that. But in essence, what communities and schools is doing is trying to, in a case managed way, support students and families with a wide range of needs. So often what a communities and schools organization will do is they'll partner with varying school districts, be positioned in various schools, and this can be elementary, middle, high school. They stretch across age ranges. And then they also identify community partners to pull in to support students and families in a way that doesn't bring an additional cost burden to families. So they'll create community partners, and these services look different depending on what's available in respective communities, but in general, they will partner with a food bank, for example, any sort of therapy and mental health, behavioral health supports that might be available. The coordinators themselves will offer a shoulder to listen. They'll have some training, usually social work background, so they can assess needs, identify needs. There are some tutoring that's sometimes available depending on the capabilities, or they might, communities and schools might partner with some other tutoring entities or pull folks in to do those sorts of supports. So really what it is, it's more of a wraparound service model. And they believe that by being placed within the school, there's also building a trusting relationship with the student community as well as the administration. So if they have a space in school and a child can easily pop in to get food, for example, it's real easy for them to pop in and out to the site coordinator, so it's not necessarily a known thing to their peers what types of supports or requests they may be giving. They'll also partner with other entities and do drives for material things like school supplies and backpacks. Some kids will come in and grab some of the food, and they'll just give them a backpack so they can transport it home. So other friends don't see that they're actually trying to supply food for the home, for the family through those respects. And it's very tailored in terms of there's usually an initial assessment when a child is deemed to qualify for the more case managed services if communities and schools is present within the school. They do ongoing assessments as well. So obviously if there's another need or an issue arises, either it's a disciplinary issue or something's going on at home that communities and schools is made aware of, they'll try to target services there as well. So the services don't just stop with the child. They are mainly focused on the student, but if something is learned that there's another need at home, some multi-tiered counseling supports might be helpful, not only for the student, but for additional family members. That's something they work to pair them with additional services that may be outside of communities and schools expertise.
It does look like there's another question that came up in the chat and the Q&As. And so there is a lot of discussion about community school models and other models that talk about the importance of community factors. How do community factors fit into the model? Well, I would say that across the framework, bringing in the community seems to be something which is a consistent recommendation for not only for helping try and manage student behavior, but for a number of the initiatives that school safety requires.
Yeah, I think I'd just add to, when you're a student within a school, within a district, within a community, there's a lot of bidirectionality there as well. So definitely important to consider.
Caleb, could I ask a question of the group?
Please.
So, and this is really for everyone and is based on, a lot of the thinking that we've done in developing the framework. And it's sort of, and on this theme of implementation, And so one of the questions that I have heard periodically from folks in schools, we want to make improvements on school safety. Like, where should we begin? What first step should we take? So I'm sort of wondering, for the panelists that talked about the development of the programs and the implementation and the evaluation, kind of knowing what you know now, would you make a particular recommendation for how a school or a school district should start if they want to begin down the path that you have been working on? Knowing what you know now, but what do they say? Monday morning quarterback. Would you recommend that they do anything differently?
So I'll jump in with my thoughts. Obviously, I'm a fan of evidence-based. I think that's a absolutely crucial aspect is supporting schools in selecting an evidence-based practice and something that has a good fit with their needs and resources and desires. And I think a big emerging area of research in implementation science is understanding this concept of readiness to implement new changes. I mean, it's not really even new. I mean, community psychologists like Abe Wandersman have been, talking about that for years. But if a setting is not ready and if they don't have sufficient resources, it's going to be really hard to implement a new program. And then, of course, that selection of a project or a program that matches well with their community values and ability to implement it is crucial. So, no answer, just I think these are things that we need to be thinking through and helping people select a program or an approach that's appropriate.
Seems that a consistent theme is the partnerships that are really kind of required in order to do a lot of this work. And so again, kind of going off Mary's question, so is there like a bare bones, like kind of partnership network that you would need to have in order to get some of this work kind of going? It kind of seems like you need to actually involve the police in some way, and then there are mentions of social work help. Do universities need to be involved? Is there other ways to do this without actually having to bring in individuals in higher education? Not that that's necessarily a bad thing, but just trying to think about implementing this in even those rural neighborhoods as well.
Yeah, Mary, if I could jump in as well, I think one thing is to consider is what are the resources that you already have in your community. And so I think even some of these projects, when they talked about implementation challenges, so like Ryan, for example, or Lauren, for example, talked about the competing priorities that may come up. And so thinking about choosing an evidence-based program like Lindsey mentioned, but also what are the resources that you already have to bear that you can pull in from the community, and how are those going to work together to promote a comprehensive plan, I think is really important. Recognizing where the risks from competing priorities, competing stakeholders, and making them, helping them to get on the same page.
Yeah, I think that's important, Nadine, and to sort of tie in, I think, a little bit of what Lindsey said in bringing in some of these implementation science outcomes into that, which I'm doing in some slightly related work off of this, which is the schools in some cases, I will say, have lots of resources and have programs and interventions. It's obviously an important question to interrogate those in terms of their evidence base. But then there are those implementation science outcomes that come in that say, okay, these things have existed here, right? People have been trained in them. They've sort of been circulating around in your building. Have we taken the time to really figure out where the sort of implementation burden lies, and starting at the very beginning, which is this an appropriate fit for this building and for your main concerns that you are trying to address? And really, that is a new way of thinking, in my experience, in coming into schools and working with administrators who want to say, we need to do this. It's important for our students. Help me think about and help me come up with implementation strategies to get the people in my building to do this. And to try to sort of walk them back a little bit to say, let's look at what you have here. and let's think about the context that you're in, the issues that you're trying to address, and then let's really sort of forefront the implementers, the teachers, right? The people that you're asking you to do this. Are they in line with your approach here? Are they in line and on board with these interventions? And because if the buck is stopping right there, then that's where we need to start, right? Is helping people understand, or at least have input into, what are the interventions? What are the issues that we want to address? Before we jump to why aren't they doing it, right? Or how do we get them to do it with more consistency? And so I just think that helping schools sort of, and school districts sort of back up to that level of interrogation into how things are going in their buildings kind of goes a long way in sort of figuring out ways forward.
Well, we're coming up right along at 5 o'clock now. Thank you so much for all of the presenters for taking the time to have this wonderful conversation. And if no one has anything else, I can go ahead and let everybody go and invite everyone to come back tomorrow for day 2 of the conference, starting at 11 a.m.
Thank you.